Hi everyone, I'm Rosalyn Anita, nursing lecturer working in Tribhulam College of Nursing. Today I'm going to present on first aid measures of drowning. So the drowning is a life-threatening emergency that occurs when a person is unable to breathe due to submersion in water. Quick recognition and proper first aid can save lives and prevent brain damage. So this presentation explains the causes, signs, emergency response, first aid procedures, CPR, prevention and complication related to drowning. So the objectives are introduction, causes of drowning, safety before rescue, methods of safe rescue, initial assessment, airway management, rescue breathing, cardiopulmonary resuscitation, recovery position, management of hypothermia, complication of drowning, prevention of drowning and conclusion. So coming to introduction, the drowning is respiratory impairment caused by submersion or immersion in liquid. It may result in death, injury, or full recovery. The lack of oxygen is a main danger, common in children, swimmers, and accident victims. It requires the immediate first aid and medical attention. So, the drowning happens when water prevents normal breathing. It can occur in swimming pools, rivers, lakes, beaches, bathtubs, or floods. When a person cannot breathe properly, oxygen supply to the brain and body decreases rapidly. If not treated quickly, it may lead to unconsciousness, cardiac arrest, brain injury, or death. Early rescue and first aid are very important in reducing complications. The causes of drowning. The common causes: inability to swim, lack of supervision, water accidents, alcohol or drug use, seizures or medical emergency in water, strong currents or deep water, panic during swimming, and slipping into water accidentally. Many drowning incidents happen because of poor swimming skills or lack of supervision, especially in children. Alcohol consumption increases the risk by affecting balance and judgment. So, the medical conditions such as epilepsy or heart attacks may also lead to drowning. Natural water bodies may contain strong currents and unexpected deep areas that make rescue difficult. So, the safety before rescue. Ensure the scene safety. Do not jump into dangerous water without training. Check for currents, depth, or electrical hazards. Use flotation devices if available. Call for emergency medical services immediately and protect yourself while helping the victim. So, the rescuer safety is always the first priority. Many rescuers become victims themselves by entering the unsafe water. Before attempting rescue, assess the environmental carefully. If possible, use rescue equipment such as ropes, sticks, life bios, or flotation devices. Call emergency services early so advanced medical help can arrive quickly. Methods of safe rescue. So, the rescue techniques: reach rescue using a stick or hand, throw rescue using a rope or flotation devices. So, rescue only if trained, remove victim carefully from water. So, the safest rescue method is reach on through. Don't go, try to reach the victim using an object on throw a floating them. Entering water should only be done by trained rescuer. Once the victim is removed from the water, place them on the flat surface and begin assessment immediately. Coming to initial assessment, check responsiveness and breathing. Check if the victim responds, tap shoulders and shout loudly. Open airway carefully and check breathing for 10 seconds and check pulse if trained active emergency response system. After rescue, the first aider must quickly assess the victim, check for responsiveness by tapping the shoulder and calling loudly. Open the airway, use head tilt and chin lift unless spinal injury is suspected. Observe the chest movement and breathing. If the victim is not breathing normally, CPR should begin immediately. Coming to airway management, maintaining an open airway. Remove visible obstruction from mouth. Use head tilt, chin lift techniques. Suspect spinal injury or in driving accidents. Use jaw thrust method if spinal injury suspected and keep airway clear during rescue breathing. So the water and secretion may block the airways drowning victims. Proper airway opening allows oxygen to ensure the lungs. If spinal injury is possible, avoid excessive neck movements and use the jaw thrust maneuver instead. Maintaining airway patterns is essential for effective breathing support. Rescue breathing. Importance of rescue breathing. Give 2 initial rescue breaths, observe chest raise, continue rescue breathing if pulse presents, and deliver slow and effective breaths. Avoid excessive ventilation. So in drowning, lack of oxygen is a primary problem. So rescue breather is extremely important. Give 2 effective rescue breaths after opening the airway. The chest should raise with each breath. If the victim has a pulse but is not breathing, continue rescue breaths until normal breathing returns or medical help arrives. Coming to cardiopulmonary resuscitation, CPR. CPR is drowning in victims. Start CPR if no pulse or breathing. Give 30 chest compression, follow with 2 rescue breaths. Compression depth about 5 to 6 cm in adults. Continue until help arrives. CPR combines chest compression, rescue breathing to maintain circulation and oxygen supply. So the high quality CPR improve the survival chances. Compression should be fast and deep enough to circulate blood effectively. So the continue CPR until the person recovers. Emergency personnel take care or you are unable to continue. Recovery position. Positioning the victims. Use a recovery position for breathing victim. Turn victim on the one side. Prevent aspiration of vomit. Keep airway open. Monitor breathing continuously. So if the victim regain breathing and consciousness, place them in a recovery position. This helps maintain an open airway and prevent choking if vomiting occurs. Continue monitoring breathing and pulse because the victim condition may worsen suddenly. Management of hypothermia. Prevent heat loss. So the remove wet clothing, cover victim with blankets, keep body warm gradually, avoid direct excessive heat and monitor vital signs. Drowning victims often develop hypothermia because of prolonged exposure to cold water. So the remove wet cloths and cover the person with a warm blanket. Rewarming should be gradual because sudden heat may cause complications, and observe carefully for breathing and circulation changes. Complication of drowning. Possible complications. So the brain damage due to oxygen deprivation, pneumonia, pulmonary edema, cardiac arrest, hypothermia, permanent neurological disability and death. So the complication occurs because oxygen supply to the brain and organs is interrupted. Pulmonary edema may develop when the fluid accumulates in the lungs. Some victims may appear stable initially but worsen later. Therefore, all drowning victims require medical evaluation even they are recover quickly. Prevention of drowning. So, safety and prevention measures. Learn swimming skills, supervise children near water, wear life jackets, avoid alcohol during swimming, install pool barriers, follow the water safety rules, avoid swimming alone. Prevention is the best way to reduce drowning death. Children should always be supervised around water. Swimming education and use of life jacket greatly improve safety. Avoid risky behavior such as swimming alone or under the influences of alcohol. Public awarenesses and safety education is essential. Coming to conclusion, so the drowning is a medical emergency. Early rescue and first aid saves lives. CPR and rescue breathing are essential, and prevention reduces mortality, and community awarenesses improve safety. So the references are American Health Association Basic Life Support Guidelines and World Health Organization Red Cross First Aid and CPR Manual. Thank you.